How is craniotomy brain surgery performed? Imagine needing to access the brain to treat a tumor or repair blood vessels. A craniotomy is a surgical procedure that allows doctors to do just that by temporarily removing a part of the skull. The process begins with the patient being placed under general anesthesia, so they are completely unconscious and pain-free. Once asleep, a healthcare team secures the patient's head in a special device to prevent any movement during surgery. Sometimes, a lumbar drain is inserted into the lower back to remove cerebrospinal fluid, which helps relax the brain and create more space for the operation. Medications like mannitol may also be given to reduce swelling in the brain tissue. Next, the surgeon carefully shaves or partially shaves the scalp and cleans the area with antiseptic. An incision is made behind the hairline to minimize visible scarring. The skin and underlying muscles are gently lifted and folded back, exposing the skull underneath. Using a surgical drill, the surgeon makes small holes called burr holes in the skull. These holes are connected with a special saw to cut out a section of skull, known as the bone flap. This bone flap is carefully lifted away, revealing the dura mater, which is the tough membrane covering the brain. The dura is then carefully cut and folded back, exposing the brain tissue beneath. Advanced tools like microscopes, ultrasonic aspirators, and computer-assisted imaging help the surgeon locate the affected area precisely. This allows for safe removal of tumors, repair of blood vessels, or other necessary treatments. During the operation, techniques such as intraoperative imaging or cortical mapping may be used to identify and preserve critical brain functions like speech or movement, especially if the area involved controls vital skills. Once the necessary work on the brain is complete, the dura is sutured closed to protect the brain tissue. The bone flap is then replaced and secured with small titanium plates and screws, which stay in place permanently. The muscles and skin are stitched back into place, and the scalp incision is closed with stitches or staples. The entire procedure is carefully planned to minimize risks and protect healthy brain tissue. Over time, the bone flap heals back into place, and the hardware used for fixation is generally well tolerated. In the context of brain health and tumor treatment, craniotomy is a vital surgical option that allows neurosurgeons to safely remove tumors or obtain tissue samples for diagnosis. While it does carry some risks such as infection, bleeding, or neurological deficits, it remains a cornerstone of brain tumor management when performed by experienced teams. Patients should always discuss their specific risks, benefits, and recovery expectations with their healthcare providers to ensure the best possible outcome tailored to their individual needs.